Assalamu alaikum jami'an. My name is Turki Al-Dahim, Cardiac Cath Lab Manager in Riyadh, National Guard Riyadh. Today I will talk about optimization inventory management in Cardiac Cath Lab. So the first question that I want to ask you, it will come in our mind. What's make cardiovascular so important to our society, for our government, that they are investing a lot of money? Medical companies, they are investing and trying to find the best cure. And even for the relatives, whenever patient have any cardiac issue, they will be like, it's affecting. So to answer that, cardiovascular disease is considered to be #1 killer in the world. It's 18.6 million deaths every year, and 33% of all global death. So it considers #1, and it's way behind cancer and respiratory disease. So what type of cardiovascular disease can be diagnosed and treated in cardiac cath lab? We are doing a lot of procedures and for diagnostic, like we are checking coronary artery disease, congenital heart disease, adult and pediatric, cardiac arrhythmia, valvular heart disease, and cardiomyopathy for heart failure. So the question is, to have this all services, there is a lot of procedure we are doing. So it's required a lot of materials that need to be existed. So how much do you think we should take care for all division, adult, pediatric, AP? Let's start the auction. Do you think it will be 100 item of material, 200, 400, 1,000? So it's around 2,000, more than 2,000 type and shape of items has to be. We need to look at it, and we need to make sure that the lab, it cannot be function without having this item exist in the lab. This is small statistic for from our cath lab. So our pediatrics types and shapes, it's around 700. AP, it's around 600, and for adult 1,200. So what the challenges are facing us as a cath lab team? Our item in terms of consumables considers very expensive and costly. And the big issue for everyone in the cath lab, that you cannot predict what the size or the shape of the catheter you need during the case. Unless the patient inside the lab, you will find out that you need big stent, small balloon, whatever. So you cannot predict that unless you do the procedure. So another challenge that we have to monitor expiry usage and annual consumption. So there is any way to control it? Yes, with stock management. If this is the best way to control things and make sure that you have all 2,500 items existed during the case, and it will be divided to two. First of all, it will be inventory management, which is strategic and planning, and inventory control, which is a part of inventory management, but it's representative daily activity. So we'll talk about inventory management, which means that what we mentioned a while ago, it is strategic and planning. It's the forecasting demand, which means how much you need per year. So you should have a capability to know how much each size that you need to have. So if you have, let's say for stent, you have 60 or 70 size, you need to know each size how much you need per year. So if you determine that and you have a good forecast for that, so you can determine your bar level, which is usually, it's depending on your hospital. Usually we put a bar level for 3 months, which means if you have 120 your consumption per year, that means you should keep 30. So So in other part, whenever you have half of it, which is half the quantity to becoming the reorder, the third things in our schedule here, which is it will give you a room. If you have 15 each, that you have, it will give you room that you can order from the company, and you have room of 1.5 month. So if you don't have PO, you can do PO. If the company, they don't have the stock, you can get it. So giving yourself a good room of time, it's perfect things in our cath lab, and it will really affect your workflow. Inventory counts, it's depend again for if you have a system, so that's mean you will do it in monthly basis. If you don't have it, if it's manual, if you will do it in yearly basis or 6 months if you have system. If you don't have system, that's mean you will, if maybe you will do it in weekly basis to make sure that you will not have any missing. And you finally conducting auditing, which is whenever you have expiry or you have more items in your shelf, that's the time you have to find out, is there any things happen? I mean, if you have new physician comer, because whenever you have new physician, that's the time you have different preference. Or let's say if there is any study showing that, saying that product it's not that effective, so you will find out that people or your physician, they are not using that anymore. Inventory control. It's procurement, tracking. I can't go, it's 3 minutes, so I have to finalize all. Procurement, tracking, receiving. This is what you are doing in daily basis. LIFO, and which is last in, first out, first expiry, first out, transfer item between labs and store. What's the benefit from managing your item? The very important things for us is patient safety. Which is our aim, to make sure that your patient, when you are doing the procedure, he will be in good shape, that everything is existed and available, expiry and record management, control cost and unit spending, improve efficiency and reduce wastage, increase team satisfaction and workflow, and that's what we are looking for. So you want your physician to be in comfort zone, that he will be trusting that everything is available. If he need cover stent, whatever things he need, he will find it. And your nurse or your tech, he will not be suffering looking for something that not existent in your lab. Order and data collection technique. There is 2 methods for ordering, either traditional method and artificial intelligence method. So in ordering, either the people can be ordered by experience. He will write a note, and he will have experience of a couple of years. Then when he left, he will leave that for new junior comer, and he will start to an intuition, which will be unorganized order, and he will even if there will be no data, will be saved for the institute. How to track or how to collect data: manual, writing a logbook and use ticker and sheet. And as we said, this will be unorganized data and difficulty in tracking the items. Simply, any organization run without data are working blind, which is a fact.
1 minute.
Thank you. What type of data we are looking for? Inventory master list, generate a daily report, generate list of data from the past to present. Benefit of data collection, to organize your budget, planning, tracking, and solve problem. Artificial intelligence, it is the best practice to integrate technology into daily workflow in our cath lab. There is three ways to do it. It's a barcode, which is you need just a PC, and it doesn't require the maintenance or consumable. The disadvantage for it's not movable, insecure for high cost. Automated inventory management cabinet. The advantage for it, it can control expensive item, and disadvantage, not movable, limited area of storing, required maintenance. RFID is just a chip or a sticker. You will put it inside the box of the material or item, monitoring expiry, and it's the best for Can I have 1 minute, please? No? The advantage, it's the best things you can recall your movable monitor expiry and recall item. Disadvantage, need manpower, which is you have to stick in each box this kind of sticker, and it need high performance. It's very cost device. To take home message, cardiovascular professional and physician is the secret of success. The teamwork between cardiovascular professional and physician is the secret of successful and smooth workflow in cardiac inventory management. Delegation responsibility is the most effective way to manage a large number of items. Last paragraph, Saudi Arabia is currently experiencing technological revolution in many aspects. We should be a part of it and integrate it into our cath lab routine workflow.